Fight against workplace shortages hits the pharmaceutical industry, leaving rural areas without easy access to life-saving medications and medical devices. WIFR News reporter Sydney Stoffregan talks with the leader from the University of Illinois Chicago's Rockford campus about how a new program could help bridge the workforce gap.
The pharmacists that are out there working end up working longer hours, more shifts.
Heidi Olson with the University of Illinois Chicago Rockford hopes an $864,000 grant to expand the rural pharmacy program is the answer to the shortage of pharmacists.
People are having to drive a significant distance just to get to a community pharmacy. With insurance being the way it is, sometimes that closest rural pharmacy, your insurance might not allow you to go there.
Studies show that the 14% of pharmacists working in rural areas care for nearly 20% of the population.
Especially in those rural communities where they may be the only pharmacy for 50 miles. Once they retire, it's very likely that pharmacy will close or have to greatly reduce their services.
Third-year student Austin Fleming says his small-town background laid the foundation for his future.
There's a lot more opportunities and a lot more stuff going on behind the scenes than people might realize. Helping to solve it once you are able to do so is a big deal.
Sandy Salverson tells me her career kick-started with a bad experience.
And I had trouble getting, the care or the service that I really needed.
Looking back, she says she suffered side effects of a drug-drug interaction, as well as a severe allergic reaction.
And I thought this can be better. And that's really been my motivation. It's still my why. It's why I think it's important of how we can provide better quality to prevent those side effects from happening.
In Rockford, Sydney Stoffregan, WIFR News.
The grant also allows alumni of the program and other pharmacists working in rural areas to continue their education to help keep them up to date on patient care guidelines and innovative pharmacy care practices.